My name is Priya Baraniak, and I'm the Chief Business Officer at OrganaBio, and I also co-lead Process Development and Manufacturing and serve as our Laboratory Director. So I'm a founding member of the company, and I have been sitting at the intersection of business and science since we launched the company about 5.5 years ago. I really enjoy sitting at that intersection of the two and saying, how do we take great science and now make it a viable business idea option and move it forward for the benefit of the cell and gene therapy industry. So we are a solutions provider to cell and gene therapy developers. We've built an ecosystem of solutions all the way from tissue sourcing businesses. We have 2 wholly owned subsidiaries that source birth tissues and adult peripheral blood, which become the cellular starting materials for cell and gene therapies. And we help with process development. We also have a GMP manufacturing facility and that vertical built. So whatever we do with our customers and partners in the preclinical realm, we can bridge that gap then from the bench to the bedside by doing the same thing GMP, providing them with those same tissues or cellular starting materials as GMP materials that can go into their clinical manufacturing. And finally, we also try to walk the last mile with our partners by building cell processing and cryopreservation services that support clinical trials, where there's a lot of decentralized clinical trials occurring. And while there are hospitals and CROs that are able to bring in patients and either draw blood or even perform apheresis, they don't have the knowledge or the infrastructure to then process that material. And the timely processing, cell isolation or cryopreservation in a timely fashion is really critical in clinical outcomes, not confounding your data, but also minimizing risk for patients and others. Our customers span the entire stakeholder value chain in cell and gene therapy development. We support academics, we support nascent biotechs who are just spinning out from academic centers or starting up. And we have established biotechs who are already in the clinical realm and are treating patients with either clinical stage or commercial products. And finally, we support large pharma, a lot of multinational global pharmaceutical companies who are also in this space. We're very excited to have announced this week at BIO the expansion of the cell processing and cryopreservation services business unit to the West Coast and a very rapid spin up of that business in support of our large pharma partners. So we've been doing this work in Miami for them, supporting many clinical trials for about 2 years now. And we were asked by one large pharma partner if we could quickly operationalize in Irvine and build scale and capacity quickly to meet their needs so that they could conduct a critical clinical trial in Southern California, given the demographics and the attractiveness of those demographics for them. And we scaled up and operationalized the lab in 6 weeks and are already processing samples for them. Along with participating at BIO as part of the California Life Sciences Group, the California Pavilion. Here I am at Bullpen today, and it's such a great venue for networking, meeting like-minded individuals with complementary skills and technologies. And so really loving the energy here.